Good people of Bushenyi, good afternoon. I sincerely thank you for standing with us from day one through every meeting, every village visit, and every challenge. Your support, encouragement, and belief in this campaign have brought us this far. Today, 13th January 2026, we hold our last rally here in Central Division. And I want to clearly say this: Bushenyi has spoken. Bushenyi has supported us. And Bushenyi is ready for accountable leadership. I also want to clarify using facts some of the issues regarding maternal and perinatal deaths in our district, where one of the contestants for Women Member of Parliament said that what have been raising is not true. These deaths are not happening. These are facts. She has been telling people that these deaths are not happening. That is an allegation. These are facts I've been highlighting through the campaign. Leadership must be grounded in evidence, and without accurate information, it is impossible to address these issues effectively. As a matter of fact, if you would allow me, I would also like to share these numbers. When you look at in 2021, we lost 9 mothers while giving birth. In 2022, we had 11 mothers dying while giving birth. In 2023, we had 11. 2024, we had 8 mothers. These are not campaign figures. They are documented district health records. When we say women and children have died, these are not allegations. They are recorded outcomes within our health system. Pointing out documented deaths is not propaganda. It is a call to improve services and prevent or reduce further loss of life. True leadership does not deny painful realities. It acknowledges them honestly and takes responsibility to act. Calling verified health data propaganda does not change what is happening in neighborhoods and maternity units. It only delays solutions. We have also seen mothers delay to come to health facilities, and that could also be a very big factor why mothers are maybe dying while giving birth. We have seen very many factors. It's not a blame to anyone. It is something that we can surely come together as leaders and we address these facts. Sharing these health statistics is not an attack on any individual. It is part of responsible leadership. Maternal and perinatal indicators are used worldwide to assess health system performance and guide improvements. For me, refusing to discuss these facts does not protect anyone. It only puts more lives at risk. When you look at deaths occurred, can see in very many facilities, including center for hospitals. And also when you look at regional referral hospitals, we are losing babies while being given birth and mothers. So this tells us clearly these are not deaths happening outside the health system alone. They could be even happening somewhere else. So when you look at across the 5-year period, repeatedly recorded causes of death include PPH, sepsis, and many others. And for the children, when you look at the most leading cause of death, has been birth asphyxia. So for me, I would think that we would sit down as leaders to ensure we address these challenges. And many records, when you look at records within the audited maternal and perinatal death, you will see even clearly that we have even cases that we do not even know why a baby maybe died. This points gaps in diagnosis and review. Majority of these causes are clinically preventable or can also be manageable with timely referral, skilled delivery, and functional neonatal services. These are system challenges, not failures of health workers. These are system challenges. And when you look at babies dying perinatal deaths, cumulatively, you'd see that newborn babies die between 0 to 7 days. That's why we have a challenge in Bushenyi, having many babies dying between 0 to 7 days. And the leading cause has also been birth asphyxia, infections, birth trauma. These high numbers of fresh stillbirths and early neonatal death indicate failures in intrapartum care and also not an avoidable outcomes. So for me, this evidence shows persistent gaps in antenatal care quality. But also, when you look at some of these deaths happening, I have information, if maybe you can tell that who is alleging, that I have data for almost every child who has died in Bushenyi, especially while being given birth. We have a few cases, I may maybe raise them. When you look at in Nyargote village, we lost a baby in 2023 on 25th of December, sepsemia. Vitoma, we have a baby who died on 27th of April 2024 due to birth asphyxia. Nshumi Charhang died, and we don't have even the cause of death. We have very many Karianshure. We have a baby who died due to fetal asphyxia, died on 12th of June 2024, and many others. Chitojo Kakanj, baby died on 5th of June 2024 due to birth asphyxia. This data is readily available. Maybe I would also want to share it with one who is alleging so that we can look for the solution. We are saying that we cannot prevent, but we can reduce. We can try to reduce these deaths based on if we have strong systems within our district. This evidence also shows persistent gaps because in antenatal care quality, because when you look at, we have sub-counties where at first NC we are not doing HB. When you go to Chabjin, the whole sub-county for the past 3 years, find that mothers are not doing HB, they're not doing ANC scan. So it's a very big gap that we must come together as leaders to address these issues. It's not propaganda or politics, no, it's about losing a life. One life, because for me, it is painful. When you look at the time, so far as our district, we're about 31.2% of health staffing levels. And when you look at the patient to nurse ratio, about 1 to 32,000. So for me, it's a very big gap. For the patient to nurse ratio, it's about 1 to 3,267. And the patient to doctor ratio is approximately 1 to 82,767. And when you look at the neonatal care units within our public health facilities, when you move to Kakanju, move to these health center trees with high volume sites, so you do probably realize that we have a very big gap that we must address as leaders. So as your woman member of parliament, I'll not manage hospitals directly or health centers, but I also use parliament to lobby budget and demand accountability so that the right equipment, systems, and services reach Bushenyi. I also want to give you my action on these issues so that anything that comes here, someone must know what I stand for. I also lobby for functional ultrasound machines in all the health center force. Functional. I've moved to some of these health facilities. Mothers have been telling me some even pay money to do ultrasound scan. So the question has been, is it for government or it's a private setting? So it's where my issue is. I will strengthen referral communication systems so facilities act early and also ensure we support the community healthcare workers working hand in hand with the DHO's office. Also lobby for more midwives and medical doctors. When you look at Rubirizi district, when you look at Katerera, Chichwamba, they have medical doctors at those health center trees. Equipment without skilled staff cannot save lives. We need both. I also advocate for hemoglobin testing machines at health center 3s and also health center 4s. And also have to ensure consistent supply of pregnancy test kits. And also essential about the supplies. Also demand regular maternal and perinatal death reviews and follow up on recommendations. When you look at financial year 2023-2024, we had about 63% of perinatal deaths being reviewed. And for me, that's a very big problem. And the few who are reviewed, you'll find majority of them are known cause of death. So it's very hard to really get to know what could be the most leading cause of death. But though we still see birth asphyxia being the most leading cause of death. I also work with DHO's office, strengthen community awareness on RNT attendance, danger signs, and timely referrals. I want to be clear. Health workers are not the problem. They are overstretched and under-resourced. My commitment, and also working with the government of Uganda, we need to support them, not to blame them. And to the people of Bushenyi, I want you to remain confident, focus on the election day on 15th of January 2026. Be vigilant, get your facts right, don't be misled. Some people think money can buy our livelihoods and our future. But Bushenyi is not for sale. Come out and vote in big numbers on 15th of January. Protect your vote. Stay at your polling station. Ensure your voice is counted. Together we shall build a healthier, fairer, and more accountable Bushenyi. Our dignity is not for sale. Our votes are our power. Bushenyi, let us finish strong. I thank you. I thank you so much.